Elbows up, up, side to side. Elbows up, side to side.
Hi, my name is Stephanie Velasquez. In this video, we're going to be doing an elbow evaluation. Hi, my name is Stephanie. I'll be your athletic trainer today. Can I treat you?
Yes, my name's Bruce.
Nice to meet you. What sport do you play?
I'm in wrestling at Fresno State.
All right. So, what happened? What brings you in today?
I've been having some pain in my left elbow. It's been about an hour.
Okay.
And it just keeps hurting, like sharp pains in my elbow.
Okay. And how did you hurt it initially? Was it at practice, during a game?
It was during practice.
Okay. And did you hit it really hard? Did you do it on your side?
I hit it like dead on when I hit the mat really hard.
Okay.
And getting brought down.
Okay. So just before we finish this, I'll ask you some about your just general medical history. Have you ever injured any other parts of your body before?
Yes, my knee, and then I've had surgery on both of my feet.
Okay. And are you allergic to anything?
Not that I know of, no.
Okay. And are you taking any medications right now?
Just stuff for allergies. That's it.
Okay. So considering this just happened right now, it might be a little bit painful, but if it's okay with you, I'm going to touch your arm, okay?
Mm-hmm.
Okay. Does that hurt when you extend it fully?
Yeah, when I extend it fully like that.
Alright. So this is more comfortable for you?
Yeah, when I bend it.
Okay, so I'm just going to put your arm as far out as I can just to see through passive range of motion how much range of motion you actually have. Okay. So his range of motion is kind of limited. It is beginning to swell, and if I press here, does this hurt?
Yeah.
Okay, so he's point tender of the olecranon process. You can relax. With this mechanism of injury, wrestling, being slammed on the mat, he has a good chance of having a fracture, or with the olecranon process, you have a fat pad here, and you also have your subcutaneous bursa. So it could be between those three things. So that's my differential diagnosis as of now. We'll continue palpating to see what we can rule out. So I'll do some compression testing and palpate the humerus shaft. Is that painful for you?
Not really, no.
Okay, and the supracondylar ridges, both medial. Is that painful?
Not really, no.
And lateral. Is that painful? Okay, and we'll go along the ulna. Is this painful?
Just when you extend it straight.
Okay, we'll relax your arm. And radius, is that painful?
No.
Okay. And it's point tender here, you said?
Yes.
Okay. So I'm going to go ahead and do a bump. Let me know if this is painful for you. Is that causing pain?
Yeah.
And this way, any pain there?
Yeah, a little bit.
So we have positive for pain for bump tests and compression over the posterior elbow. So this could be positive for both bursitis. We can have a fat pad displacement or a fracture. Since I cannot verify any of those, I would have to refer him to a physician for radiography. In addition, if the radiography comes back that it is bursitis, we can ask the doctor if we need to follow up with an aspiration. So we can aspirate the bursa and follow up with care with that way. If it is a fracture, or because I do think it is a fracture, I will, before he leaves, we can splint him in a flex position so that it is comfortable in relieving pain and relieving that pressure from gravity. In addition, I'll treat him for pain with we can give him some NSAIDs and write all of that down so that he can take that with him to the physician. For fat pad displacement, we'd have to follow up with the physician, see what they want to do. So while we're doing this, I could do, for a global outcome measure, we can do the McGill pain scale. So we can write that down or SOAP note. We can do the short form, which is basically like throbbing, things of that sort. So on a scale of 0 to 5, 0 being no pain, 5 being the most pain, how painful is this injury compared to your other injuries?
Probably like a 3.
Okay. All right. So after we follow up with a physician and get our imaging done, I would like to do an elbow outcome measure, something that is going to measure his functionality, and we can see how his activities of daily living will be affected. Pause. Okay, so before we send Bruce off to the physician for imaging and other testing, I can go ahead and splint him. When I splint him, I will make sure that there's enough room for additional swelling. It is swollen, and you have that deformity that's from the edema present. It's hot, so right now I'm just going to be safe and splint for a fractured either ulna or humerus. I'm not really sure with the general localized pain and swelling focal to the posterior elbow. So we can do a sling and swab in this position. While we're doing this, we're going to be measuring and recording. We will measure and record distal pulse, and we can do that radial. It'll come back within normal limits. If a fracture is present, it may be altered. With bursitis, it should be normal because it's in the posterior elbow and it's not affecting the blood vessels that are anterior to the injury. Neurological testing, I can do these with the fracture as well because I think my diagnosis is going to be the bursitis. I will go ahead and do them, but I don't think that is necessarily applicable to olecranon bursitis. So go ahead and close your eyes for me. Put your hands out on your lap. Perfect. Do you feel this?
Mm-hmm.
Do you feel it evenly on both sides?
Yes.
Okay. And any abnormal sensation?
Nope.
Okay. Do you feel this?
Mm-hmm.
Do you feel it evenly on both sides?
Mm-hmm.
Any abnormal sensations?
Nope.
Do you feel this?
Yep.
Do you feel it evenly on both sides?
No.
And do you have any abnormal sensations?
No.
Okay. Do you feel this?
Mm-hmm.
Do you feel it evenly on both sides?
No.
Any abnormal sensations?
No.
And do you feel this?
Mm-hmm.
Do you feel it evenly on both sides?
Mm-hmm.
Any abnormal sensations?
Mm.
Okay, so he definitely has some differences bilaterally. Is that just more on this arm? Or
Yeah, on
the
that
right arm?
on this arm.
Okay, so his left arm, the affected limb, is having some different stuff. So we could have had impact to that ulnar nerve. Definitely hit that funny bone with the mechanism of injury. Or he could have something fractured that's compromising a nerve or blood vessel and causing that numbness, which is like an analgesic feeling for the patient. And other than that, I will wait to see what comes back from the results. Thank you.